Hi, I'm Zoe Jones and I'm the founder of Holistic Fertility Therapies. I'm going to show you how to administer a progesterone injection. So first of all, I'd just like to say only administer what you are given and what you are issued by your medical practitioner. And ensure that you take it at the times that you've been instructed to and the timing that you've worked out for yourself. So what do you need? You need your progesterone injection. I am on 40 micrograms, 0.4 microliters, so you will take whatever you need to take. You need a wipe, and you need a box to put your to discard your needle in. Usually you would get a proper medical box. However, I got my medication online, so I haven't quite got that. So this will do. And then when I go to the hospital next, or the doctors, I will hand that over and allow them to dispose of it in the correct manner. So when you are told, you are told during your protocol from your fertility practitioner to take your progesterone at certain times. Now I'm taking it vaginally and an intramuscular injection as well. So I take 400 in the morning of the vaginal method and 400 in the evening, plus 400 of this. So I'm not saying to you that's what you should be taking. You really do need to speak to your medical practitioner and follow what they have suggested. But you could set your timings around or change your routine accordingly, because it is easy to forget to take your medication, as I did the other night. But I didn't panic. I just took it when I remembered. And if you've got any other questions, just make sure you go back to your fertility practitioner. So, some people have a needle phobia, and it isn't easy taking these. So I've gone so far as numbing the area before. So I've used ice cubes, I've used numbing gel, and it's all worked. But I got used to it, and now I use nothing apart from breathing. So first of all, when I ask you to find your area that you're going to inject, just lay the needle onto the area, and then just take a big deep breath. Take a couple if you need to, and on the out breath, that's when you administer and push the needle into your skin. And if you have to, just keep doing that breath until you have pushed the needle all the way down. Just keep doing that breath. Because if you stop breathing, that's when potentially you could faint. Okay? So, first of all, we're going to find the area that we're going to administer this injection. And it's I usually do each side, one side that night, and then use this side the next night. And you've got to be 5 centimeters away from the area of your belly button. So I did that area last night, so it is this area tonight. And what you've got to do is pinch a nice bit of skin. No judgment here, please. And just wipe the area nice and clean. And lay that over there. And then all I'm going to do is pop off the lid. Now it could be a little bit tough, so just, there we go, pop it off accordingly. And if there's any bubbles, just use your nail to knock the bubbles out. And what I do then, I put the needle in my forefinger and index finger and middle finger, and then I use my thumb to push it down. So I get the area, Then what I do, I just change. So I'm pushing the needle in with my index finger. Okay, so ready. A couple of deep breaths. And on the out breath, I'm just going to push it. There we are. And then you keep it pinched. Keep it pinched. And slowly depress the white button. So it's all the way down. And then I just allow it to stay there for a couple of seconds. Keep breathing. And then take the needle out. Pop the lid back on. Ouch. Without stabbing yourself. Put it into the container. And then I'm going to sit back and I'm going to imagine that that is nice golden liquid that is just running through my body now, and my body is soaking up that nice liquid, golden liquid, that is going to make my lining, or nourish my lining, make it thicker, and the embryo is enjoying that progesterone. The blood supply, the blood vessels are now being nourished. So that's what I'm going to do. So I'm going to say a quick goodbye, and please, I hope this has helped. If you want any more information, go to www.zoejoneshft.com and my social media as well, Instagram, Facebook, Zoe Jones Holistic Fertility Therapies. Take care, bye.